Three important syndromes. A syndrome is a group of several clinically recognizable features, characteristics, or symptoms that together are characteristic of a specific health disorder or health condition. In this section, we are going to review three very important syndromes that were originally researched by Dr. Joseph Deck in his book, Principles of Iris Diagnosis. The three syndromes are called cardioabdominal syndrome, cardiorenal syndrome, and pancreatic syndrome. Each syndrome has a specific combination of iris signs within the iris. They are found in the polyglandular iris subtype and are always genetic, showing a potential for the signs and symptoms associated with that syndrome. Now we're going to discuss the cardioabdominal syndrome. This is a genetic cardiac risk sign and is in the left iris. The signs include a large lacuna or honeycomb crypts in the areas of the heart, the splenic flexure, and the descending colon area. These signs must be seen together in the left iris or it cannot be called a syndrome. The genetic tendencies of this syndrome are: they tend to have bloating that can cause pain and pressure in the chest and on the heart. A sensation of a pulse may be in their throat. There may be an accumulation of fluid in their abdominal cavity. These people may feel weak, like they're going to faint. They may have acid reflux and intestinal cramping or flatulence due to an imbalance in their intestinal flora. Remember, this is a genetic tendency, and it often doesn't show up until the person's in their middle ages. Now we're going to discuss the cardiorenal syndrome. And these people have a cardiac risk sign. It's only shown in the left iris. And there can be a large lacuna in the heart reaction field and another large lacuna in the kidney reaction field. This syndrome usually does not surface till middle age as well. Their genetic tendencies can include swelling in their arms and hands due to poor circulation and improper function of the heart and kidneys. They can have extra fluid in their legs as well. They can have labored and difficult breathing, heart palpitations, fatigue, aching in their upper back and shoulders, sweating, bloating, loss of appetite, or nausea. Now we're going to discuss the pancreatic syndrome. This syndrome appears in the right or the left iris, and they have large lacuna or honeycomb crypts in one or more of the pancreas regions. Now remember, the pancreas is at 10 o'clock, 2 o'clock, 4 o'clock, and 8 o'clock. And in this person, they have lacuna in all areas. They also have lacuna or crypts in the lung and the nasal or bronchial regions. They tend to have deficiencies in the pancreas, lungs, bronchial tubes, trachea, sinus passages. Their tonsils can be swollen or sore. Fibrosis, which means thickening, can occur in the pancreas. Fibrosis and scarring can occur in the lungs and may cause them difficulty with their breathing. They may have a tendency for pneumonia, asthma, or emphysema. They may have snoring due to sleep apnea. This is the pancreatic syndrome, and it often doesn't occur until later in life. And with any of these syndromes, if the people are seen by an iridologist ahead of time, we can prevent these problems from occurring by teaching them healthy nutrition and the way to breathe and exercise.